This is going to be a video on how to use the tracking board for our system. Now, the tracking board is unfortunately a different system than Paragon, where you document and where you do your notes. So there's a lot of bouncing back and forth between the tracker and between Paragon. And so some of the things I'm going to go over might be a little forward thinking, referring to stuff that you would need after you've learned how to do the documentation in CPOE. So I'm doing this from my virtual desktop, which you will have access to do screen recording. So this goes for all the videos, but unfortunately it's not going to be exactly the same with a lot of things. So this is kind of what the virtual desktop looks like. Normally there's a tracker icon here, and I'll search for that and pull it up in a second so you can see what it would look like. But the big things you're going to want to learn on your desktop are Paragon, WebStation. This one right here, this is where you're going to do your CPOE, your orders, your documentation, how you get to HPF. Your Dragon Medical One, this is for your dictations and how you can save macros. When you open this up, you just type your first and last name, no password, and you're ready to go. The ERADs, which I don't think you can use from your virtual desktop, or the PACS, and then the tracker, what we're going to go over in this video. So for the tracker on here, I'm just going to have to put Emergency Department Management, and this is what the icon should look like. So I'm going to log in. If you have trouble with this at home, be sure to note that you need to put it on to production. So here's what the tracker looks like. On this corner up here, you're going to have your different options of what you want to see. You can have all patients and see the entire emergency department, which is going to be including discharges, be including admit holds or admits, and including the waiting room, where you can just click to see what the waiting room is looking like. I usually keep it on active patients and then go around from use this to see what I want to look at next. There are ways that you can change the look of your tracker. For instance, I arranged mine to have this order of room, doctor, resident, patient, acuity, radiology, labs, etc. So you're welcome to arrange it however you want. To arrange it, I believe you click on this tab right here, and maybe not. Well, I won't show you how to do that, but when you do your formal training, Misty or somebody will show you how to arrange things how you want to do, how you want it to show. But that's not really what's important for this one. But there might be some other things that you can take out, like the sepsis screening or stuff that you might want to add that I didn't personally choose. So next is kind of navigating the rooms. You have the room assignment, the doctor, which is the attending, and then you'll have the resident here. And then I have the patient, your acuity level if it's a 2, 3, or 4. And we can see whatever we want. The 4s are not isolated just for the fast track. And you can see your kind of status on lab and radiology. So this means that 12 have been ordered and 7 are back. So that does not mean that you should wait until you see 12 out of 12, because some things won't come back. If it's a send out, or if it's a blood culture or a urine culture, this is never going to get all the way there. Radiology, if it's 1 out of 1, that means that you ordered one and it's been done. It doesn't necessarily mean that the radiology or the X-ray or CT has been read. You can double click on it and see, and then I think if this thing is here, that means it has been read, and so you can see your report. I do not recommend clicking on the labs and trying to view the labs. It takes forever, and usually you end up just Xing out. So really the best thing to do for radiology and lab is to view it on Paragon. That's what I meant by there's a lot of back and forth. If you want to see the chief complaint of the patient, you right click anywhere on this patient. I'm sorry, not the chief complaint, the triage note. You right click and you hit triage. So you right click and you go down to triage. Here's a side, going back to arranging your desktop. So I guess you right click and hide move columns, and here's where you can change what's on the tracker, and you can pull them up or down to the way you like it. So sorry about that. So you're going to right click on the patient and go to triage, and you'll be able to see the vitals, and there should be a patient narrative. There you go. Shortness of breath, respiratory distress. That's about all we get. But you can see the age and the other pertinent things. To sign up for a patient, there's a few different ways. You'll see here where it says ER physician. That is the code that you need to sign up for a patient, saying that an ER physician needs to sign up for this patient. Sometimes you'll have a resident filled out but no attending, which means you need to sign up for the patient you're seeing with your resident. Sometimes it'll just say this ER physician, and sometimes it'll just be blank. If it's blank, it's just real simple. You double click on it and your name will go on it. You can see my DRD came on there. We prefer them to put this code for ER physician. To change this back to the ER physician, let's say you want to unassign, you're going to do right click and details. And right click and details on this tracker do a lot of different things, so remember that. So I'm going to go to the doctor portion right here, and I'm going to type last name, first name. If you scroll, there's tons and tons of names of doctors who haven't worked here in years. So I'm just going to physician ER, and I'm done. So if I wanted to sign up on this one, the ones that said physician ER, because again, that means that the doc has not seen the patient. You're going to right click, details, and then you can just put in your first name. You can see the different options: acuity, status, room. But what you're going to do here is put your name on the patient. So Darrigan. And again, I'm not going to scroll for it because there's just too many names. It takes a long time. And then if you look on the tracker, it does this. I'm glad it showed that a lot of times it doesn't do it right away. I bet if we right click and try to do it again, it's going to say Darrigan. So it just takes a second to update sometimes. It's a really crappy system. So if you refresh it, long refresh, it says DRD. I don't really know what all these are. I just pay attention to the ones I need. So I know I need this refresh one. I'm going to change this back to be seen. So I'm going to put it back to ER physician. So I type in physician ER. Okay. Now a little forward thinking. The way you activate a discharge on this system, the first way you can do it is in your note. So in your note, if you're finishing your note and you're ready to discharge a patient, you can click the discharge button from Paragon, and it's going to translate over here and put that to a pending discharge. And I know a lot of other people forget a lot to hit that discharge button in the note. So if you forget, you have to come back to the tracker. You're not going to put an order in for discharge on Paragon. You're going to have to bounce back to this tracker. And on this tracker, you're going to right click and go to details. And that's where you would go to the status. So you go to the status and you can make them disposition to DC or pending discharge. Disposition to DC would be if you tell the nurse, let them go after their antibiotics go, let them go after their fluids go, and you want them off your list, or you want them to know that they can leave when that's done, you would put it as disposition to DC. But when they're completely ready to be discharged, you put that as a pending discharge. So you just click between the different ones, and it's going to change them and move them over to this column over here. But it's a trigger for the nurses to know it's time to discharge the patient. So I'm putting it as an active patient, keeping it as an active patient. You can also, when you're admitting them, you can do the pending admit to give the clerk a heads up that you put an admit order in. There's very few things in the systems here that are connected, so you're doing a lot of double work to let people know what you're doing with the patient. One thing we're encouraging is seeing patients in the waiting room or pulling them to triage 2 basically, to see them in an area so they're not leaving without being seen, that we're able to see them in triage 2, maybe discharge them, maybe start up a workup, a minimal workup. To do that, if you wanted to place orders on that patient, in Paragon, they have to be a certain status on the tracker. Paragon and this tracking board do communicate somewhat. So you have to go to the patient in the waiting room, right click, and go to details. And there's a lot of different things you're gonna edit once you're trying to see a patient in the waiting room. You're gonna change the status to an active patient. And I'm not going to leave it on this since these patients are real in the ER right now. I don't want to mess things up. But first thing you're going to do is change the status to an active patient. Then you're going to go and assign them a room, because you can't order things on a patient if they're not assigned to a room. But you're not going to assign them to a regular ER room. We have these RME rooms, rapid medical exam, that you would see them in triage 2, or you could put them in a waiting room triage room. If you choose any of these, or even a hall bed, they're down at the bottom. If you choose any of these, it'll activate things in Paragon to where you can then order stuff for them or document. And then again, you want to put your name. So if you're grabbing a patient yourself to see in the waiting room or to pull to triage 2 and see them, you're going to make it an active patient. You're going to change the room to waiting room or RME, and you're going to assign yourself. So 3 different things. Let's see, what else is there to go over on the tracker? There's ways to pull reports if you're interested in seeing how many patients were seen yesterday. Just click on reports and you can mess around with it from there. But I think it's important to remember that the way we're seeing patients here is by the tracker. It's not by waiting for the physical charts that simply need to go away, but it's by the tracker. So again, this patient would need to be seen. I'm just going to put it as physician ER so they know to go see the patient. Now, when you're on your actual desktop, I wish it was as easy as Google Chrome, where you could just click between the tabs to see the different, to go to the different systems. But unfortunately, it's not. There's going to be a icon bar up here with all the different systems in the hospital. But what's easiest to do is when you get to your computer, it should log you in automatically to, it should log you in automatically to both your tracker and to your Paragon. Doesn't always, but it should. So you're going to make sure you're logged into both. And basically, if you just minimize the Internet Explorer button that you're going to have, it's not working on this because again I'm on my home one, but if you were to use this Internet Explorer button, it would bring up your Paragon, and then you could hit it again and it'll bring it down and your tracker will be there. So it takes a little bit of working on how to float between the two, but when I've had trouble, I've gone with searching or just pushing the internet button down here and it'll bring back up Paragon. The other thing you can do is if you don't see your tracker, sometimes you log into a desktop and you don't see the tracker, you do what I did. You go to Start and you go to Search and you type in emergency and you'll pull this up.